Hi everyone, I chose to do the Culture and Medicine investigation paper on France. So why France? I think it's very similar to the United States. I was curious to see how similar and to compare their healthcare systems, their policies to what the United States does, and then also see if they have cultural competency programs or classes or if they have issues similar to what the United States has as well. The U.S. Census Bureau of 2000 reports 5.3% of Americans are from France or have French-Canadian ancestry. The early migration of the French to the United States may have been a repercussion of the French-British War when the French citizens wanted to flee the country. The United States of America was, at the time, well developed on the map and showing promising signs for industries and wealth. However, history shows most of the French went to the northern part of America, Canada. With the way the United States government and society is so controversial at the moment, I think it's highly doubtful more French citizens will migrate to the United States. I also believe the current status of France is appealing to the people. Their healthcare and policies are showing positive benefits for the people. So the disease prevention and health promotion in France is pretty similar to the way the United States is. However, something that is just amazing is France has the highest life expectancy out of all the European countries at 82.4 years of age. The French are still facing a battle with smoking and alcohol abuse because it's such a part of their social life, but statistics are showing improvement through prevention strategies. Healthcare is easily accessible to the French people because of the Hospital Patient Health and Territories Act, which pushed into effect the requirement of all residents to receive a form of social health insurance. And the European Commission also addressed the out-of-pocket payments people pay in France is only 7%, which is much lower than the European countries' average of 15%. And if we even consider in the United States how we have so many people that have to pay out of pocket when they have a healthcare scare or issues, and for France to have 7%, that's amazing. Now we know from the multicultural health textbook, someone's worldview is linked to his or her cultural and religious background. The predominant religion in France is still Catholic, but more women are using forms of protection against pregnancy and in a way not choosing to follow a religion. A study was performed over a 10-year period to evaluate the progression of contraceptive methods. The researchers discovered hormonal-dependent methods declined, while natural or barrier methods rose. Moreover, marriage is also becoming less of a thing in France, as the average age is 29 years of age to get married, and 1 in 3 relationships are ending in a divorce. Now, complementary and alternative medicine is very similar in France as it is in the United States, with a high prevalence with little support. The impact of alternative medicine in the quality of life is still undetermined. The study discovered most Europeans chose the alternative methods because they were unsatisfied with conventional medicines. The study goes on to discuss alternative forms of medicine needed to be researched so there is more support. The French would benefit from alternative medicine such as meditation or acupuncture because the French tend to live these very busy social lives. And in my opinion, I think they would benefit from taking a moment to have peace of mind through meditation or acupuncture, just a way to relieve the stress or the burden from the busy day. Now, with the use of more contraceptives comes the decline in birth rate. Now, since 2014, it went down from 818,565 to 769,553 children born per year. Now, those who are pregnant in France also get 10 weeks of guaranteed maternity leave, with which they can split with how they choose before and after the birth. And those in France who still follow the Roman Catholic religion would follow the 7 sacraments of the Catholic Church as rites of passage. They include baptism, reconciliation, Holy Eucharist, confirmation, holy orders, marriage, and anointing of the sick. A Catholic child's upbringing would generally include baptism before the age of 7, normally, and then reconciliation is starting the process of confession. Holy Eucharist usually begins around 2nd grade and continues until confirmation at age 14. And then once the child becomes an adult, Holy Orders is continuing involvement in church for the rest of the person's life. Then you're marrying someone from the opposite sex in the Catholic Church, and the anointing of the sick is partaking in the church commending those who are ill and or suffering. The French paradox is a term used to explain the French people enjoying an abundance of saturated fat, whether it be butter, margarine, things like that with their food, but not having a population with a high rate of heart disease or obesity. Some examples of why people who live in France have a low rate of diet-related diseases is because they live active lifestyles, walking frequently, and they consume a lot of fresh foods from markets, as you see in this picture. Among French adults, 36% of men and 25% of women were active at the recommended level when including their occupational physical activity. And then when excluding their occupational physical activity, these proportions were 23% and 19% respectively. Now, those in France tend to not perform a workout with high intensity like the United States, where CrossFit and strength training is becoming more of a common way to be active. They're more active just in their lifestyles and their way of their daily routine. The suicide rate in France for males was approximated at 25.5 per 100,000, and then females was about 9 per 100,000. Now in France, neuropsychiatric disorders are estimated to contribute to 32% of the global burden of disease. The mental health policy was revised in 2015 to shift services and resources from mental hospitals to community mental health facilities and integrate mental health services into primary care. Therefore, I believe France is becoming more accepting of these mental health conditions, and they're trying to gain research and help those who are suffering, much like the United States is as well. With a decrease in church attendance in France comes less of a religious focus on death. Cremation is spreading more throughout the European countries, and it's up to 32%. The cremation process regards the person's choice of their own body's fate after death, almost a celebration of individuality. The United States and France are territories who respect individualism as a way of people rewarding their independence and autonomy. France is also considered a territory that values individualism. Now, something I found interesting about medical school in France is that the medical students pay almost nothing, while the average debt of a medical student in the United States is about $154,000. Now, the study, or the researchers that did the study, discussed how Americans will tend to have more pressure on their shoulders, and sometimes we will make more mistakes because they have this burden of this debt that they know they have to start paying off. So some examples of acculturation or assimilation in France was a neighboring country. The migrants entered France and they started to change their eating habits to include more of a Mediterranean style, with the fresh fruits and vegetables, a lot of fish. And then the Islams were coming over as well, and they were following the Muslim religion, and they were getting upset with the French because they pray 5 times a day, and the busy lifestyle of the French was not allowing them to. So some ways that I found that the French and the United States were similar was in their changes in the economy with mental health disorders, more fast food, less exercise, low birth rate, decrease in religious beliefs, and then the increase in the complementary and alternative forms of medicine. The most staggering difference is the way healthcare is run in France. The French people are covered by phenomenal health insurance, and those who go to medical school practically attend for free. The level of cultural competency in France seems to be well established, with room for improvement, similar to the United States' current status as well. And then these are just the references for all of the information I just gave you. Thank you.